Okay, we're back. Got the camera plugged in, so this should work now. It shouldn't run out of batteries. As I was saying, my due date, based on this calculator that I use that goes off of your last menstrual period, the first day of your last menstrual period, which is how I guess they calculate it at the doctor's office when you go. My due date is April 3rd, 2011, which very, very ironically to me is the date of my gastric bypass. Exactly 2 years later to the day I am due to give birth. How strange is that? I am convinced that some things are just meant to be. I'm a big date person. I'm a big numbers person, and when I found out that my due date was April 3rd and that was my date that I had gastric bypass, it blew me away. Anyway, so my due date is April 3rd, which means I have 34 weeks and 6 days left of being preggers, and I am on week 5 of my pregnancy right now. I'm actually one day, I'm 5 weeks and 1 day today. So I have an appointment on August 13th to go in, and they're going to take a bunch of blood work. They're going to confirm the pregnancy with a blood test, which it is the most screaming. Okay, you guys, I peed on 2 sticks, not even in the morning, and it was like the most glaringly positive pee stick I've ever seen. It was one of those that was either a plus or a minus, and on the plus one, so the minus is like the control line, so that's the line that's always there whether you're pregnant or not, right? And then if you are pregnant, there's a plus over the minus. Well, usually most people's pregnancy tests, the positive, the test line, the plus part, is lighter because that's the line that's detecting how much HCG is in your system. And my test, the little control window was like super faint, and the plus line was like bright hot pink purple. And I was reading up on the internet, and basically that means I have a ton of HCG, and my positive result was drawing all the dye out of the control line to prove that I was really positively pregnant. So I took 2 of those, and a couple days apart, and they were both glaringly positive, so obviously pregnant. So I don't know what that means. I don't know if that means I'm further along than I think I am, or multiples. I hope neither of the two. Further along would not be as bad as multiples. That's just scary to me. So I'm not going to think about that right now. But I will say that twins do run in my family. My father is a fraternal twin, so it's possible. Anyway, what else was I going to talk about? Oh, I have the most awesome doctor in the whole world. She has been taking care of me ever since I had surgery in Mexico. She was so supportive of that. Very, very knowledgeable about gastric bypass. She also delivers a lot of babies. And she recently changed clinics where she works at. She used to work here in the town that I live in. Unfortunately, now she works in Portland, which will be a little bit more of a drive for me, but I decided with she knows everything about my medical history. She's followed me, since before surgery, after surgery, everything. And I really couldn't imagine having anybody else see me through this pregnancy than her. So it's worth the extra drive to me. I had emailed her, and she immediately sent me this great email back, and I think I'm going to read it because it's really informative for people who are considering getting pregnant after gastric bypass or find themselves pregnant, such as I did after gastric bypass. Okay, my doctor, Dr. Warren, she says, "Kristen, congratulations. Sorry I didn't get to my email until now. I've been out of the country and didn't have email access." And then she goes on to say, "Most folks recommend waiting 12 months after surgery because this is the time period of the most rapid weight loss. Once weight loss is stabilized or decreased in rate, like yours, it seems to be safe to get pregnant. Regardless, it's still important to track your weight gain and the growth of the baby with serial ultrasounds, which we will easily do, especially in late 2nd and 3rd trimesters. There have been a few studies done with women after bariatric surgery who get pregnant. The preterm birth rates do not seem to be increased, nor do any rates of any other major baby congenital problems. The C-section rate may be higher, but some feel that it's related to women who are still obese despite having the surgery and not the surgery itself." The most common nutritional deficiencies are of protein, iron, vitamin B12, folate, vitamin D, and calcium. Most recommend drawing these blood levels at the beginning of pregnancy, which I'm going to be doing on the 13th. She ordered all that stuff to be drawn, along with my confirmation of pregnancy. And considering following them once each trimester, so 3 times total during the pregnancy, unless a severe deficiency is found, which she doesn't think I'm going to have any problems with because I've never had any vitamin deficiencies up to this point, so that's good. I will place an order for these to be drawn at your next appointment, blah, blah, blah. Okay. You should be taking, this is the important part, because this is the part that I was most confused about, was prenatal vitamins and what I should be taking, since I already take lots of vitamins. Anyway, she says you should be taking a prenatal vitamin. Each prenatal vitamin is a bit different. In addition, I'd like you to take the following starting now. Vitamin B12, 1,000 milligrams daily. Vitamin D, 2,000 units daily, or close to it, depends on the brand or form you buy. Iron, a daily supplement, which also depends on the form and brand. Check your prenatal vitamin and let me know what it has in it. Calcium, 1,500 milligrams daily. You have to split this up and take about 500 milligrams 3 times a day. Tums has 500 milligrams in each chewable tablet. You can take one with each meal. Now I know that we are supposed to have calcium citrate, which is not the kind of calcium found in Tums. Tums is actually calcium carbonate. Sorry, that was a text. Oh shoot, I didn't mean to do that. But my doctor told me that we can take Tums, which is the calcium carbonate, as long as you take a tiny sip of something that contains citric acid, such as orange juice, or even Crystal Light has a little bit of citric acid in it, because that is what we are lacking in our stomach pouches that allows us to absorb the cheaper kind of calcium, the calcium carbonate that's found in Tums. So that's a good tip if you don't want to shell out the big bucks for the really expensive calcium citrate supplements, or if you just don't like the taste and the texture of them, which I don't most of the time, then you can do Tums. Just make sure that each time you take one, you take a little sip of something that has the citric acid. So there you go. So Tums 3 times a day. And then she goes on to talk about diet. Most recommendations are for a diet of approximately 60 to 80 grams of protein per day, not a specific caloric amount. I may send you to a dietitian to talk more about any specific questions you have, because I had mentioned that as guilty as I feel about this, like one of my major things right now is that I'm freaked out about gaining a bunch of weight. I just spent the last 1.5 years working my butt off to get weight off of me, and now I find out I'm pregnant and I'm going to be gaining weight, and it freaks me out. And I want to make sure I can do everything I can do, you know, to grow a healthy baby, but I also want to maintain my healthy body at the same time, and minimize the amount of weight that I'm going to have to get back off after the birth. So anyway, we're on top of it. Let's see, how are we on time? Okay. She also says, because of the surgery, we need to pay attention to the nausea and vomiting, bloating, and diarrhea that may be normal in pregnancy, but could be related to the surgery. This is the tricky part. Hormones change quite rapidly in pregnancy and can cause all kinds of symptoms. So I got to watch my symptoms real carefully. Finally, I'm excited for you and would love to care for you during this pregnancy. I start at the Gabriel Park Clinic tomorrow. A nurse named Sandy Nelson is the prenatal coordinator at that clinic. I think I'll have her give you a call and set up a time for a prenatal intake visit with both me and her on the same day to minimize your drive if you would like, which is awesome. She's like the best doctor. She's always thinking about me and like how to make it easier for me. If you can find a doctor that does these kind of things, do not ever change doctors. She also says that we're going to do an early ultrasound in the office as well, from about between about 7 to 9 weeks along. And let me know if you have any questions, Dr. Warren. So that was my email I got from her, and I'm super excited that she totally is supportive and going to help me through all this, and it's crazy. So yeah, that's it for now. I'm 9.5 minutes, so I'm going to go, and I will try and keep you updated. I haven't started posting these videos yet because we haven't told our family yet, and we're kind of waiting until I'm a little further along to make sure it's going to, you know, like stick. So by the time you see these, I will probably be a little further along, but I at least wanted to start documenting my journey now as it goes. All right, guys. So I hope you guys are having a great day. Make healthy choices. Bye.